We're getting new data on vaccinations in our state, and things are moving slowly.
Very. As of today, 520,150 doses have been delivered, with 140,245 of those going into arms across the state. So according to the CDC, Michigan ranks among the worst states in the country at administering the vaccine. Now, with this rollout still in its very early stages, we wanted to see the challenges health departments are dealing with that could be slowing down the process.
We want to bring in Defender Sean Lay live tonight with what he's uncovered. And Sean, the target was to get to 20 million Americans vaccinated by the new year. We haven't even come close to that number.
Let's keep crunching the numbers. 250,000 doses that were delivered still in freezers here in Michigan right now. Let's talk about vaccines locally. Wayne County, just over 12,000 vaccines administered, more than 18,000 vaccines in Oakland County, 8,800 vaccines administered in Macomb County. Most of those, however, are vaccines coming from the federal government and then the local health departments filling in, vaccinating mainly EMTs. Let's talk about Macomb County. Big county, lots of vaccines. Things are about to ramp up big time there. Macomb County is getting 1,000 doses of COVID vaccine a week. Officials say those doses are not stacking up in a freezer. They're coming in and they are being given out primarily to about 2,000 EMTs around the county. There are doses available and the county is reaching out to nursing home employees and residents to get doses to people there. Remember, 2 doses are needed, but the county is not holding on to that second dose.
That question is a very valid question. No, they don't hold it back. So in other words, every time we give a dose, we hold a dose. That's not what's happening. We are given the indication that, when that next phasing comes about, we are going to get the number of doses that are needed to accommodate the folks that have already been given the vaccine. So it's going to be a new dose coming in that we're going to be administering.
The headline from Macomb County Executive Mark Hackle: next week, the county will be asking for 10,000 doses a week as counties prepare to move to phase 1B when the state gives the go-ahead to vaccinate essential workers and then people 75 and older. But counties need more direction from the state to say who is an essential worker.
Our bigger concern is the second phase of being more specific on what those, emergency workers are that we're talking about here, essential workers. That's we're looking for a little bit more clear definition with that, and a little bit more, understanding as to how many can we ask for, and are we going to get that delivery? So we want to make sure what we're asking for is what we're getting.
Mark Hackle also says, keep in mind, they had to hire people to administer those vaccines, so they put out notices and did get people to sign up, and they have to pay the people to get the vaccines as well. Everything is in place, and everything is going the way they think so. However, they're waiting for more guidance from the state when the next phase kicks in. That'll be essential workers and people over the age of 75. That's why starting next week, Macomb County is going to ask for 10,000 more vaccines a week, and they say they can administer 10,000 every week. Back to you.
Sean, I think a question that is coming up among most Americans right now is about how the CDC defines an essential worker.
So we looked that up. Sure, CDC and what they're defining as essential worker is right in our wheelhouse. We're talking about grocery store workers, anyone working in manufacturing, police and fire, teachers, people who work in daycare centers. But that's the CDC's definition. Mark Hackle says they want a clear definition from the state on who is essential so they can identify those people, get them in and get them vaccinated right away.
You got it. We will stay on top of that as well. All right, Sean.